On behalf of the National Collaborating Center for Indigenous Health, welcome to today's webinar, Knowledge Translation Approaches and Practices in Indigenous Health Research. So good afternoon to those of you joining us from across Canada, and good morning to our colleagues that are joining us from Australia. I know it's really early in the morning for you there, and we really appreciate that you're here with us today. So my name is Donna Atkinson. I'm the Research and Operations Manager at the Collaborating Center for Indigenous Health. Our center is located in the beautiful town of Prince George, BC, which is on the traditional territory of the Lheidli First Nations. And Lheidli means in the carrier language, people from the confluence of the river. And the two beautiful rivers that we have here are the Nechako and the Fraser. I'm going to be moderating today's webinar, but before we get started, I'm just going to give you a quick overview of the Collaborating Centers for those of you who aren't familiar with us. So the Collaborating Center for Indigenous Health is one of 6 national collaborating centers for public health located across the country. I won't go into all the ones on the screen here, but all of our sister NCCs are focused on specific topics. We are the only one that's focused on the health of a population. So our center supports health equity for First Nations and Métis through knowledge translation and exchange. So specifically, we work to identify knowledge gaps and needs to stimulate research in public health priority areas. We translate and disseminate new and existing research into user-friendly formats, and we try to foster networks and collaborations among public health professionals, researchers, and policy and program decision makers. We know that Indigenous health research in Canada and globally continues to be taught, developed, designed, regulated, and conducted in ways that don't prioritize Indigenous peoples' ways of sharing knowledges. The same can be said for knowledge translation. Our center, certainly, we want to be that bridge between researchers and policymakers, and we want to be translating good research. One problem that we have here in Canada, at least, is that we have a lot of interest from researchers. They want us to be their KT partners. So we write them a letter of support for their project, and then we never hear from them again. So I think research could be done better, and so could knowledge translation. And I'm really excited to hear from today's speakers in their experiences globally in terms of what that looks like. Before we start, I'm just going to give you some quick housekeeping details. So all the questions for panelists, as well as any technical questions you might have, you can put into the question and answer pane, which is just at the bottom of your screen, along with all your other Zoom controls. Links to resources mentioned in the post, we'll try our best to put into the chat window for everybody. And today's session is being recorded, and it's going to be available on the NCCIH website after the fact. So just a note as well that there might be some brief pauses as we move from speaker to speaker. So the learning objectives of today's webinar are to understand what knowledge translation is and why it's important in the context of Indigenous health research, to learn about common challenges and barriers to effective knowledge translation, as well as ways that KT has worked well and benefited Indigenous peoples, and also to consider ideas and ways to better advance, facilitate, and support KT in Indigenous health research contexts. So with that, I'm going to hand it over to our next presenter, Melody.
Hi.
Thanks, Mel.
Yes, I'm Simon Brockapay. Just kidding. Simon Brockapay wasn't able to join us today, so I am going to do a little bit of what he was going to speak about, but certainly not the full extent. And so if you have a chance to hear him talk about this in the future, that'd be wonderful. So just by way of introduction, my name is Melody Morton Ninomiya. My father is Japanese. My mother is Swiss German Mennonite. I grew up in Japan as a youngster and then spent most of my adult life in different parts of Canada. I'm currently living and working on the Haldimand Tract, which is home to the Anishinaabe, Haudenosaunee, and Attawandaron peoples on the Dish with One Spoon treaty lands in what's also known as Waterloo, Kitchener-Waterloo, Ontario. So I'm a daughter, I'm a mother to 3 kids, and a sister, an aunt, and a niece, and work as an assistant professor in the health science department at Laurier, and hold a Canada Research Chair in community-driven knowledge mobilization and pathways to wellness. And I was planning on enjoying listening to the webinar with the rest of you folks, and listening to Simon Brockapay and the other wonderful panelists, but sadly he's not able to join us. So my role here is to briefly introduce what we mean by the term knowledge translation in the context of this webinar, and specifically knowledge translation in Indigenous health research. Knowledge translation is akin to other terms. I know in some of the social science and humanities world, sometimes people use terms like knowledge mobilization. But knowledge translation is probably one of the more common English-speaking health research-related term that people use. But in short, knowledge translation, or KT, if you will, is about making research matter. And I know Simon were on the call, he was planning to speak something along the lines of a spiral image that I think was going to weave together something around the seasons of research, or the phases that come with the seasons of research, as well as iterative learning and researching as time goes on over, as time passes on. But what I would like to highlight for now is shown on this slide here. A couple of things that we just want to put out there as sort of a shared understanding as we move forward with this webinar. The first is that KT is the process, or the processes through which knowledge is transformed into action, that it's inherent and intrinsic to Indigenous knowledge systems. And frankly, knowledge without practical relevance does not have merit or value in a research context. So one of the things that really stuck with me was going to a CIHR new investigators meeting back in 2016. Raglan, Dr. Maddox on this call, and I were at this event, and Marlene Brandt Castellano, a Mohawk trailblazer and academic scholar and elder among many notable roles, said in one of her keynote addresses, if you create knowledge in true partnership, it does not need translation. So I'll just say it one more time. She said, if you create knowledge in true partnership, it does not need translation. And I remember when I heard that, I was thinking to myself that was, I don't know, somehow that stuck with me. And I think the more I thought about it, my takeaway is not so much that she's saying that KT doesn't need to happen, but rather that KT is never meant to be a separate thing from the main parts of what people understand as research in sort of a non-academic Eurocentric context. And that's all I had planned to sort of cover sort of as an introduction by way of the language we're using of knowledge translation. So I'm going to hand it over to Raglan Maddox.
Thanks, Melody. Appreciate that. I think Gosh, you really summarised that quite nicely, and I guess that's one of the key points that I was going to speak to. But before I do begin, I just wanted to acknowledge the traditional owners on the land on which I'm meeting and dialing in from, and also pay my respect and acknowledge the traditional owners on the land on which we're all dialing in from, wherever we may be. I'm Raglan Maddox. I come from the Bargamani and Modowa clans in Papua New Guinea, and also, as Mel sort of mentioned, I Associate Professor at the National Centre for Aboriginal and Torres Strait Islander Wellbeing Research in Canberra, Australia. I'm going to talk a little bit today about some common knowledge translation challenges and areas for improvement, and a brief overview of the findings from our systematic review. And then I also sort of wanted to provide some context to why we're doing this why we did the systematic review, and also touch upon or provide some context for the method that we use, which I think both Donna and Mel have sort of touched on the importance of privileging Indigenous voices. Next slide, thanks. As I mentioned, I'm Raglan Maddox. I'm the youngest of 3 children. I have 8 nieces and nephews, and part of my relationship, or the interesting relationship I have with colonisation, is that I do come from Milne Bay in Papua New Guinea, which was part of, or governed as part of, Australia until 1975, when we became independent. And the reason I talk about this is that I think everyone has different experiences with colonisation and those ongoing impacts. And so I've got a photo at the top right, and there's a sort of a faint blue square. The person forth from the right-hand side of the screen is my mother, and the person on the far right is my uncle. And they're the only 2 remaining siblings of between 8 to 10 children, depending on how you count foster children or those sort of relationships. And in a country with universal healthcare system or something similar to that, to have those 2 as the only ones left at mid-60s means that there's some significant areas for improvement in the healthcare system. And then the photo below that is a photo of the wharf where my sister recently, I say recently, it was 10 years ago now, but she renewed her vows. So she's been married for about 30 years now. And so it's sort of a tourist plug, actually, because there's amazing snorkeling and scuba diving in Milne Bay. The other reason I like to sort of share this is, and I guess coming out of or coming through COVID-19 and the impact that the pandemic has raises a whole range of challenges that Indigenous peoples face. And so one of the challenges that we faced, or I faced, was trying to ensure that my mum had the COVID vaccine shot, and going through that process, one of the pieces of documentation we needed to provide was a date of birth. And I knew that my mum had 2 dates of birth because she has one with the tax office in Australia, and then she has one that's her actual date of birth. And through the independence movement, I guess my mother ended up with 2 different dates of birth. But then when we were going through and trying to actually get her immunised, we found out that she has a 3rd date of birth, which is something like the 1st of January 1901 or something ridiculous like this. But we only found that out because it was one of the barriers to accessing the COVID vaccine. And so one of the reasons I like to talk about or touch on those sort of practical examples is that it impacts the way that we engage with institution systems, the way we generate knowledge. And so the first couple of slides that I'll share today is a little bit about that. Next slide, thanks. So this is a slide recently. I was watching my favourite nephew play basketball for Papua New Guinea. And I a little bit tongue-in-cheek, he's not necessarily my favourite nephew, but I like to keep the competition rife so that we always exude Indigenous excellence. But he was representing Papua New Guinea in the under-15s Pacific Cup. And so there's my sort of nieces at the front end of the line, and it sort of goes back to the older generations. And the reason I bring this up, and sorry to hear that the Raptors didn't make the playoffs this year, but he ended up getting fouled out in the 4th quarter, and we ended up losing to Fiji by 6 points or something like that. But one of the things I really was encouraged by this was that he got in good trouble. I guess he fouled out in a way that he's trying to take on the game and trying to change the game. And I think there's some synergies between what we're talking about today and that the fact that he's trying to take on the game and make a difference and make change. And I guess that's a common theme from what Donna and Melody were speaking about earlier in terms of doing research and making sure that we're taking on research and generating knowledge to have an impact, to be impactful to the respective communities that we're working with. And as Melody said, if we're doing work in partnership or if Indigenous communities are leading, governing, driving research, then the research that we're undertaking or supporting or whatever it is that we're doing should have inherent value to those communities. Next slide, thanks. And so it's really important to acknowledge the context. I'm dialing in today from Cairns, which I acknowledge is stolen land. And And with that comes a whole range of implications. When I look at the system that Australia has built and the similarities between Australia and Canada, we have this colonial machine that has been active in actively oppressing Indigenous knowledges, ways of knowing, being and doing. And so when we look at the academic literature, we also need to recognise this. And that's one of the reasons why we had the sort of governance set up in this systematic review. This piece of machinery, or this image, was actually done by Maya, Melody's daughter, at a recent national workshop we had, or with some feedback from communities at a recent national workshop we had around commercial tobacco use. And the context of that is that in Australia, similar to Canada, I guess there's actually probably a few things I should start off with. One is that the sacred tobacco use or traditional tobacco use isn't the same in Australia. In fact, we didn't necessarily have traditional tobacco use in Australia, and it's generally an import. Well, it is now a completely imported product, but the relationship with tobacco in that context is completely different. The impact of colonisation is that Aboriginal and Torres Strait Islander people were excluded from the cash economy, paid in rations of flour, tea, sugar and tobacco. They weren't engaged in the formal education system, and the first university graduate wasn't until 1960s. In the 1960s also, civil rights movement in Australia meant that Aboriginal and Torres Strait Islander people were engaged in the cash economy. And so that payment of flour, sugar, tea and tobacco placed a value on commercial tobacco and the industrialised tobacco product in ways that other populations haven't experienced. And it means that there's a disproportionate impact on health and wellbeing outcomes as a result of that commercial tobacco use. And so feedback from the communities that we were working with was that we needed to share findings and share some of the research to support people to be commercial tobacco free in ways that made sense to them. And this was one of the ways, explaining that process, explaining the disengagement or the active exclusion from the cash economy and the education system, the theft of land, which ultimately impacts tobacco prevalence or smoking prevalence, commercial smoking prevalence in communities. And while tobacco was the outcome, or maybe not the outcome, but well, the health outcome was tobacco-related death and disease. That's just one subject matter, one subject material that we could look at across a whole range of things. Next slide, thanks. And so it sort of brings to the point, or is a nice case study to look at the way that Euro-Western ways of thinking and conducting research currently dominate contemporary research. And we saw this throughout the systematic review, and it was something that we were conscious of. It suppresses Indigenous ways of being, knowing and doing, and can lead to unsafe research design, can conduct an analysis, marginalises Indigenous peoples and knowledges, and also is built on unfair or unjust expectations and beliefs about superiority, and particularly built on white supremacy. Next slide, thanks. So whenever we're doing research or whenever we're building research design, I think it's important to think about ontology and ways of being, what exists, what is real, who values it, why is it valued. Next slide, thanks. Because these values and principles inform everything that we do. Epistemology, ways of knowing, what is knowledge, how do we obtain it. Next slide, thanks. Axology, ways of doing, the value and the way we value and conduct research is also important. Next slide, thanks. Methodological, how do we acquire knowledge and knowledges? Next slide. Which leads us to the systematic review. And I also just wanted to touch on, I guess, relationality and the importance of self-location. You'd have noticed that in introducing myself, I explained who I am, where I come from. And this isn't just a matter of identity. This is a matter of how I come to know the world, the way that knowledge is generated, the way I understand things. And so when I do that, it's part of my accountability, so that you know who I'm accountable to, but also who claims me, who my family is, and how the knowledge that I understand, or how I interpret that knowledge, which can be very different depending on who we are and where we come from. And you can see today, when we look at the panel that, Indigenous peoples are diverse. There are millions and millions of Indigenous peoples around the world, and we all have different values, protocols, processes, even if there are also many synergies. So a couple of things is sort of 2 slides summarising the systematic review, or looking at the results of the systematic review. Importantly, when we did the systematic review, we did use academic search engines, but also looked at the grey literature. As I mentioned, the exclusion from the education system means that Indigenous voices aren't commonly emphasised or stressed, or often research is done on Indigenous people and not with or not led or governed by Indigenous peoples. And so this was critical to the way we undertook the work. And I'd encourage you to have a look at the systematic review paper for sort of the details around that. But we identified about 8,000 articles, and once we went through the inclusion-exclusion criteria, we were left with about 51 articles, which speaks to, I guess, the challenges within the academic system about trying to share and promote and understand how knowledge translation occurs in Indigenous contexts. And so part of this and part of the webinar today is to share and celebrate some of those KT strategies, to acknowledge that diversity, to acknowledge that nation-specific KT models are essential. But as Melody mentioned, and as Donna mentioned in the opening, if we build in those Indigenous voices and governance and leadership throughout the research, the KT models will be inherently built into that process. Implementing policies to hold researchers, funders and journals responsible to Indigenous communities. I think it's important to touch on this, but if we're upholding ethical processes, then that accountability to those communities, to the respective communities, should be inherent as well. Building KT evaluation frameworks into health research, funding KT projects. Often we find one of the challenges that I face anyway is that we get funded to do research, and then the ability to then go through and increase the longevity of those research findings and make sure they're optimised as best we can be challenging, especially without funding. So we're often trying to do things on shoestring budgets. And then this sort of speaks to the value of Indigenous knowledge. Is one of the things that isn't recognised or isn't commonly recognised within the academic literature anyway, is that recognition of kinship and social networks in the literature, and how that can help spread information, change behaviours and other things. And then embedding KT knowledge, KT processes in Indigenous research training. Next slide, thanks. We found that across the literature, there are a whole range of KT goals. We found increasing awareness of access to service, safety and practices, changes in individual behaviour, changes to health programs, services and systems. So moving beyond describing individual body parts to looking at the system of change, and making sure that we implement research in a good way. We found a diverse range of methods and approaches, including but not limited to partnering with people and organisations, ensuring that community members lead KT, so not necessarily just in an advisory role. We commonly see advisory roles or roles without teeth or decision-making ability, but making sure that Indigenous peoples are engaged in a meaningful way. Making sure it's accessible. So just to come back to the image of the colonial machine at the front end, and I know that this will resonate differently with different people, but this was just one message or one communication tool that resonated with some people and was quite different to your standard presentation, fact sheet, report or academic publication. So making sure we're listening to communities to embed ways that make sense to them in the local that local context. And then, as you can see in that last column, also meaningful Indigenous involvement, sharing KT mechanisms. So one thing that seems to be common across communities is this the ability to share food, to break bread and to socialise. Feasting is a good way to bring people together, and I think it speaks to the value of relationships and relationality. Communicating, as we mentioned, following local practices, principles and protocols, and focusing on organisational change and sustainability. So not only how can we embed or recognise the diversity in KT, but how can we make sure that the system supports that? How can we make sure that there are resources, time, funding and other things to support that? Next slide, thanks. And so on the outside, and where we're looking at a 2,500 word academic publication, it might look like we have a big idea. Someone gives us some funding, we build it, we do it, and overnight success happens. But the reality is it's very different, particularly when you're working with communities. There's a whole lot of hard work that happens. There's a lot of relationships that have to be built. We talk about having 1,000 cups of tea with communities before we start to consider developing a research proposal or that sort of thing. And so I think that spiral that Melody talked about, this ongoing relationship, research not being a sort of a one-night stand or a first date, but being a long-term commitment is incredibly important. Life happens, we get a lot of help. We had COVID-19 pandemic, we have Black Lives Matter, Aboriginal deaths in custody in Australia. We fail a lot, we're insecure a lot, and then all of a sudden we try to get good outcomes. So the road is difficult and it's complicated, and we need to acknowledge that reality. Next slide, thanks. I'd also just, shameless piece of self-promotion. No, not really, but I know there are a number of people from Turtle Island in this publication, but ethical publishing in Indigenous context is important. And it speaks to some of the challenges we talked about before around how do we make sure the system is operating in an ethical process and giving voice to Indigenous peoples. And it also speaks to that accountability that we all have, not just as researchers, but publishing houses, funding bodies and others. And so I'd encourage you to have a look at this piece because it goes into a bit of detail about the way knowledges are valued or not valued and how we can make sure that we're aware of the prejudice and bias that we all come inherent within us, and that in acknowledging it, that we can then do something about it and act on it. Next slide, thanks. So why is Indigenous governed and led research important? I think it's important to understand and uphold those Indigenous worldviews to make sure that we're respecting those diversity of Indigenous peoples and making sure that the work that we're doing is optimised, to make sure it's of the most value, and to make sure that, as Melody said, that knowledge translation process isn't necessarily a translation process, but is inherent within the generation of knowledge itself. Next slide, thanks. And so to finish, I just thought before I hand over, and you've sort of heard a whole range of systemic and challenges that we face, but also things that we can do to counter that, and a range of resources. And I saw that it'll be available after the webinar as well. So thanks very much. And I'll pass over to, I think, Michelle.
Thank you so much, Raglan. Next slide, please. As the sun is coming up over here on this glorious country that I'm connecting with you from, I just want to begin with gratitude and acknowledgement of the unceded lands, seas, skies and waterways of what we call Warramai Bore country that I'm connecting with you from. I want to pay respects to our elders past and present for their continued connection and caretaking of these sacred lands since time immemorial. And I'd also like to just acknowledge all Indigenous people that are connecting with us today. Next slide, please. As Raglan just explained, our social and cultural positioning is really important. So let us first introduce ourselves. My social and cultural positioning influences the ways in which I see the world, the way I conduct research, and how I translate knowledge systems. So really, it's well expressed here who I am. I'm Michelle Kennedy. I'm the granddaughter of Kieran Kennedy, a Wiradjuri man from New South Wales, Australia. My grandfather's a descendant of station workers or slaves and sheep shearers who moved around and worked all across Wiradjuri lands. My grandfather didn't receive an education past early years, but he highly valued it. And he is the sole reason I entered a PhD. So although I'm a Wiradjuri woman, I didn't grow up on my lands. I grew up with this elder here, Uncle John, on Warramai country. And it is these lands and people who raised me. It is these people who took me out on country and taught me what it means to be Aboriginal. So I'm a mother first, a stepmother, an auntie, a sister, an artist, a community development practitioner, social worker, and now Aboriginal health researcher. My bapu raised me to be of use to my people. If I learned a skill or I studied at uni, he would ask me, what are you going to do about that now? As I discuss my KT today, I'll reflect on what my grandfather taught me and how that influences my research. But it's not just me presenting, so I'd like to hand over to Flick to introduce herself.
Good morning or afternoon all. I'd like to also take a moment to acknowledge the traditional owners of the Wonnarua people where I'm dialing in from this morning, as well as my own ancestors and elders whose wisdom and knowledge really guides me through today's webinar. So my name is Felicity Collis and I'm a proud Gomeroi woman from the fresh waters of what we call the Namoi River Run in northwest New South Wales, Australia. I come from a line of really staunch and strong Aboriginal women who have taught me first and foremost what it means to be an Aboriginal woman, mother, daughter, sister, and cousin. My first teachings have come from my mother, grandmother, and great-grandmother, who have always shared their knowledges and wisdom about what it means to be dispossessed as Aboriginal people, but also about the importance of continual learning and knowledge sharing. I'm the first in my family to receive a Western tertiary education, including now completing my PhD. But it's my community learnings and the responsibility to the relationships I have with my community, and therefore the accountability to improving the lives of our people that must always come first. Now, as a mother, and this is my son in the slides, I'm also responsible for passing along these same teachings to my son and the future generations that will come after me, and I carry these responsibilities with me every day. Next slide, please. As an Aboriginal woman and researcher, I hold great responsibility and care for the work that we do. We must delicately and sensitively hold that knowledge translation and sharing is not just about research practices and processes, but it's also about cultural protocols and the responsibilities that come with those protocols. With knowledge comes responsibilities, and this is always at the forefront of our daily lived experiences as Aboriginal people. We are always critically reflecting on what's needed next or what people don't understand so that we can ensure future work and knowledge sharing for our people. And this is inherent and fundamental to who we are. Knowledge translation for us is deeply embedded in relationality and reciprocity for and with our communities. Alongside this responsibility, we acknowledge those who wish to work in a space to improve our health and well-being. And so they too have a responsibility to us as Indigenous people to ensure knowledge translation and sharing is conducted and upheld in a way that is truly meaningful for us. Thank you. Back to you, Michelle.
Thanks, Flick. Next slide, please. So Melody opened today so well for all of our presentations because if you create knowledge in true partnership, you don't need KT. And I really wanted to acknowledge that I can only be here to speak on the topic of knowledge translation because of my trusted, reciprocal and long-term relationships with Aboriginal communities in research practice. And I wanted to share with you some examples drawn from my recent work that I've had the privilege of working with exceptional researchers to help me lead. And these researchers weren't found in the university. They were found in our community. although Raglan Maddox was also on it. So there was some university. But I want to acknowledge that these community partners, their elders, and also their unceded lands. The project I want to speak to you about is called Which Way, which Aboriginal and Torres Strait Islander people, we use a word which way, which has a range of meanings, but essentially it's anywhere of what, where, or how. So for us, you might say, which way, and it could mean how are you doing? And we wanted to call the project Which Way because no matter where you live across our vast country, you're likely to know the saying which way. But also because the project was asking Aboriginal and Torres Strait Islander women and communities to work with us to build an Indigenous-led evidence base for smoking cessation care for and by our women. So for those that have read the literature on knowledge translation, you'll be aware of the importance of stakeholder engagement throughout the course of the research. As Indigenous academics, though, we're both the stakeholder and the researcher, which gives us a privileged position to conduct strong translational work. The challenge, though, is that often this translational work is not always recognised in the academy, and the translational work, particularly in my experience, and as Raglan spoke to, is often unfunded. The research I do doesn't include stakeholder engagement, but rather shared ownership. The stakeholders are the researchers. They inform questions, analysis, interpretation, and dissemination with me, and further direct the knowledge translation activities that are relevant. Next slide, please. So we want to recognise that there is limited literature on the specifics of co-owned and governed Indigenous health research for other researchers to draw on and understand the ways in which they can conduct research. So I want to speak in a moment to a research supplement that we did. But while we're in the process of writing a supplement or a series of papers on the research outcomes, we were offered an editorial position in a journal. And when we went back to our co-owned and community partners to speak about this editorial and what should we write, our partners really highlighted that we should actually explain how we do the research and explain the processes that we take to develop research in this way. So I just wanted to do a bit of promotion of this paper that was co-written with one of our community partners who is both an Aboriginal health worker and an executive manager of an Aboriginal health service. And it caused a bit of a stir because I'm not sure if you use a word like deadly, but deadly here means like that's amazing, that's awesome. And so we did put doing deadly research in a medical journal, and the deadly and COVID-19 we're going to fire up some special search engine hits. So we like to push the boundaries over here in Australia. Next slide, please. So look, when we want to talk about knowledge translation, it's not to take away from the importance of peer-reviewed journals. As an Aboriginal woman who came to research after having a career elsewhere, I was quite alarmed at how we are spoken about in these peer-reviewed journals, particularly in terms of smoking. So the literature, when we're speaking about Aboriginal and Torres Strait Islander people and tobacco, is often just speaking to the high rates of tobacco use, our low rates of education, failed randomized controlled trials. What we didn't have, in my opinion, was a lot of Aboriginal and Torres Strait Islander voices, true voices. There was a lot written on our body parts, as Raglan spoke to previously. So when we were conducting this work, we realised we really wanted some high-level academic outputs because we knew from our community experience that our communities weren't receiving the best healthcare in terms of tobacco control. I had spent years speaking with Aboriginal women about their experiences of smoking and becoming pregnant, and had them tell me, well, a doctor never told me to quit, or a doctor never offered me support. So we knew that we needed to target this demographic of people and really start to change the narrative about our people. So when we were searching for journals, a few things became apparent. We knew that we needed a high impact journal, so this work could be seen, respected, upheld within those knowledge systems that were outside of our Indigenous community, because we alone can't solve the problems that colonisation has brought our people and our communities. We also knew that we needed to target journals that were going to get to our health providers and our policy makers. But we also knew that there was a range of papers that were very specific in our pieces of work, and we wanted them held together so someone could see all of them all together, not across different journals at different times. And so we reached out to our Medical Journal of Australia, who are both a high impact journal, but they also have a process to have a supplement. So it's in addition to any issue of the journal. But when we looked at the supplements that this journal had done, there had never been, that we could find, an Indigenous-led or community-owned supplement. So it was always going to be a tough call to work within a system that may not be ready for the types of work that we wanted to produce. So all the publications for this piece of work were published in a supplement in the Medical Journal of Australia. Long story short, we got there in the end. It was a bit painful through the process, but we have then gone through a series of ensuring that this supplement, all of the relevant papers and findings were presented to key policymakers nationally and through state-based meetings and presentations. So look, to my university, this is a beautiful success story. It has a gorgeous artwork that my mother painted. It has my daughter and one of our colleagues and her son on it. Looks great. Next slide, please. But we also know that translational work must move beyond peer review publications, and it must address the application of findings beyond partnering communities for a broader impact. So my approach to KT addresses the criticality of relationality. And that is that I believe as Indigenous researchers stands us apart from non-Indigenous researchers. And this component of KT should never be underestimated, but it also feels like it never ends. So as part of my KT work that's not measured by a university like my 12.8 impact factor journal is, but I've come to a point to think that maybe it doesn't ever have to be. It's about drawing on our relationality, our connection to each other, to people and communities to make research meaningful, useful, and actually do something. So the primary knowledge translation activity that I've done for Which Way has been workshops. And to be honest, this is not something that I sat down at the start of the project and thought, oh, fantastic, we'll write a supplement in the Medical Journal and we'll go and do a series of workshops across our communities. This is something that came because of the partnerships. So when communities started to hear, oh, Michelle has this research and this finding, they said, well, come and tell us about it, Michelle. Come and we're going to get all our staff together and you're going to come and do a workshop. You're going to present to us and we're going to understand how we can apply this to our work. So pictured here is my biggest knowledge translation success. And this is where I brought my research back to the Aboriginal health workers and midwives that cared for me during my pregnancies with my 3 children. So after I shared the research and findings to a room full of our maternal health staff, their manager turned around. I had all my papers and I presented all of my findings and had my beautiful slide deck, and the manager turned around to all the staff in the room and said, well, what do you think? Do you think Michelle's got it right? Do you think she's reflecting the women in our community? And I feel like it was silent for like an hour. It was probably about 30 seconds. And then this lady up the back, who was my Aboriginal health worker, said, yeah, she's all right. She's got it right. Now, what are we going to do about it? And so the workshop went from sharing information and making sure that the communities understood what we were finding to really critically thinking about how can this inform the ways in which we're providing services for our women. So simultaneously, we've got peer review papers that are addressing policymakers and calling for change, like changing to here Medicare item numbers or the provisions of healthcare. But then we're also talking to the people on the ground that that are delivering services where we're not waiting for a policy change, we're taking action. We're self-determining the ways in which we need to care for our women and making sure that we're always trying to do better. Next slide, please. And at the end of that workshop, when the staff all said, well, now this is what we need to do, the staff of that service then came on board to expand the partnerships for the project, which in turn is then driving the next phases of the research. So the research for me has never ended. It's just continued to go through its next life course. But each time it's driven by this wide range of knowledge translation activities, but also my partnerships with these communities. So our work's also been, these workshops have also been conducted nationally. So in Australia, we have a Tackling Indigenous Smoking program, which is a national program. And this is about population health approaches to tobacco control. So the program, I went and delivered workshops. I've delivered sort of different types of workshops for this program for the last going on 2 years now. And it means that we're not relying on relevant Aboriginal and Torres Strait Islander communities to find my research articles. Although they can easily do this as much as the next person, it allows Aboriginal people to ask questions of the research and to take time to work through and consider the application of that research to their fields of practice. So our KT moves beyond just disseminating research findings to focusing on the application of those findings. Next slide, please. As Raglan has spoken about, as Indigenous people, we have the right to drive research to improve our lives, but we also have the right to self-determine what is meaningful knowledge translation. So if we're going to uphold our responsibility to knowledge, and for myself in particular, my responsibility to our future generations, we need to ensure that strong partnerships are made with Aboriginal and Torres Strait Islander people and communities, but not just made, but they're sustained because they are reciprocal, trusted, long-term relationships that go beyond an individual that you might get along with or that might answer your phone call, to having really, really in-depth relationships with people to ensure that the work that you're doing has meaning. And as my grandfather says, is of use to our people. Thank you.
Great, thanks so much, everyone. That was wonderful. I would invite all the speakers actually to just unmute and turn on your cameras. I think at this point I'll stop sharing as well. Maybe before we get to some of the questions that have come in the chat, do we have any kind of thoughts on future directions that you haven't already shared? Maybe we could start at the top of my screen with Melody.
I was going to go last. Anyway, well,
I can come back to you. Felicity.
great. Go for it. Like, did you want to start us off?
Sorry, couldn't find my unmute. You'd think after 3 years of COVID, I would. When I was thinking about future directions and having some reflections with Michelle, as a PhD student, there's a lot of talk constantly about how I bring my lived experiences into my work as a researcher and learning in this space, as being an Aboriginal woman and a community member. But what I also am starting to see and really think about is how we embed these approaches for our future generation of researchers. And so that's been something that I guess I'm really passionate about, is ensuring that our future PhD students and HDRs and research workforce is led by strong Indigenous people, but also as, PhD students, we're provided with a strong learning ground to be able to uphold our values as community members and Indigenous researchers. So for me, it's really thinking about how we embed knowledge translation and these practices and responsibilities and protocols at multiple levels.
So just to follow up, I mean, what do you think are the most supportive ways to support new researchers in the field? In Canada here we have a Indigenous mentorship network program. We have national gatherings of Indigenous graduate students, that kind of thing. I mean, is that something you folks are doing in Australia?
Well, the first thing that I think of is have Michelle Kennedy and Raglan Maddox as your supervisors. The best guides that you could ever have. I don't have anything like that I'm a part of. So I actually am very reliant on the senior Indigenous researchers that are in this space to create other spaces for me to be able to come in as a HDR student. I think it can be quite an isolating experience. There's not, for me, there's no collective, I guess, as a HDR student that I can necessarily be a part of. So the relationships that I do have with my supervisors and their commitment to carving out spaces for me to be in is what's most important and most useful for me, in Australia.
Maybe Raglan, we could move to you.
Yeah, it's a good question. I also think there is actually an Indigenous network, a health network set up, so we should make sure that you're involved in that. But it's only recently established. So I think, as Melody mentioned, I did my postdoc at the Well Living House in Toronto, and so I was able to see sort of the infrastructure and able to attend some of those gatherings. And so that's something that, we don't necessarily have the same infrastructure in Australia. We definitely don't have the same funding models. And I think that is something that we could hopefully leverage and share. I know there's also some good partnerships across Australia, New Zealand, Canada and the US. So I think sometimes leveraging those to see what processes are working well for each other and how we can almost in a competitive nature challenge each other to do, and not necessarily each other, but like funding bodies and others to do better, to create space for Indigenous researchers like Flick and those future generations is really important. I think the other challenge we face, and we sort of have talked about some of the systems barriers, is I think we all in the academy experience some sort of weathering and tiring, having to fight for space, time, money, resources to do these things that are inherent in our responsibilities. So a couple of examples, I guess, like the ethical publishing process is a nice example of making sure that publications are also holding researchers to account, because we know, like you were saying at the beginning, Donna, like someone might ask for a letter of support or something, and they'll get that letter of support, they'll get some funding, they'll get their ethics approval, and then potentially never hear from anyone again. So how do we make sure that accountability is there throughout the process, from conception right through to dissemination of results and publications? Because I think that's really important that we try and change the system in that way. But also it can be tiring as an Indigenous academic to read that deficit-based narrative all the time, or to have to fight for those things. So I think creating space for each other is really important. And also, I used to, when I presented at U of T, this is showing my age a little bit, but I used to share a slide with the students from a Drake song that was something like, a wise man once said nothing at all. And I think that's really important. I think sometimes it's really important to just give people space, give Indigenous people space to do what they have to do. And then the last one, I'll try and just wrap this up with the question as well, was I think some of the Indigenous data sovereignty principles are really important. A lot of the work I do in a National Centre for Epidemiology and Population Health is dealing with government or administrative data sets. But there are ways that we can that we can embed Indigenous data sovereignty principles in that. So for me, it's almost a repatriation process that I can do 5 years worth of ethics processes and governance and other bits of paperwork to return Indigenous data back to communities so that they can own their own data again. But that's essentially the process. So I think even if the logistics of some of that is really difficult, I think we can uphold some different ways of upholding Indigenous data sovereignty principles that mean that the data and the questions and other things that are being asked in a good way. I think I'll stop there.
Michelle?
I think that we need more of this conversation about what is knowledge translation and some critically reflecting on how we can do better is a great first step for us. I know that Raglan and I have had conversations even recently, which is work that we're about to lead into with our Aboriginal and Torres Strait Islander communities about what does KT look like? What are kind of the series of things that people could do in knowledge translation that could be meaningful to you? So I know that we have been here in Australia looking at embedding knowledge translation as a bit of a criteria for grants. So people are asked to speak to how they'll do that in grants. They're asked to how they'll speak to it how in their ethics. But more often than not, people say that they're going to disseminate a community report and they're going to do some peer-reviewed paper in a conference. And because there isn't a lot of literature on what actually is knowledge translation in this space, it's just kind of ticked off that they said they translate findings and we'd move on. So there is a real need to continue conversations just like this and make sure that we are upholding what it is to do knowledge translation with Indigenous people. We need to be writing on it. We need to be speaking on it. We need to be thinking on it so that, as Flick said, in the future, people actually are grounded in some kind of knowledge base to do more and to do better, because it is just so easy in the academy to do a community-based report, send that off to an email address and pat yourself on the back that you did a great job and move on to the next project. We really don't currently reward researchers who do incredible knowledge translation in the academy. You know, the peer-reviewed papers and the international conferences are the things that they really love to see. But to me, I guess I wanted that, and it has been done to me too, but I wanted that anyone could stop one of my community partners and say, oh, you're doing that project with Michelle, what's happening with it? And that any one of my community partners could say, this is what we're doing now. And I've seen it in action when we published our paper in MJA, still those peer review papers where I had Aboriginal health workers posting it everywhere and printing it and giving it to people at events and gatherings, because they're like, this is ours. We did this work. This is our work. And so I hope that in the future, more communities can feel so empowered and love research as much as we do, because they can see that it's useful, that it's of benefit, and that it's doing something. But I'll stop there.
Yeah, a challenge that we have at our center is we produce materials for a really broad range of folks. So academics down to, you know, parents that are going into parenting programs. And the challenge with the academic publications is always that once you give it to a journal, it's theirs. So you feel like it's kind of gone out there and maybe not as well read. So, or the same with if you publish a book. So what we've tried to do now is develop all these supplementary resources. So videos and podcasts and webinars so that you can really get more into depth, and it's free of charge for people. I think it's really important. But yeah, Melody, I'll just turn it to you and then maybe we could get to some of the questions in the chat.
Sure. Yeah, no, I jotted a few notes down, but I feel like I want to riff a little bit off of Michelle's comment around doing work that that communities are excited about. But also I was thinking more about some of the projects that I've done where the bar is so low, I think, for communities that have worked with researchers in the past, that they don't necessarily even know that there's more options to ask for, or like, I think it's within their rights to ask, but there might not be examples to draw on, or the conversations aren't being made, or the researchers just don't even know where to start to think outside of their usual academic box. That I think some of the knowledge translation work needs to also happen at the community level, for communities to know what they can ask for as part of research projects and have them embedded and funded by the projects themselves. And then I was thinking too, in terms of like, because I'm situated in an academic institution, it's like part of my responsibility to also like train or teach, or at least get people to be thinking, talking, and doing some of this work, depending on where they are in their academic journey. And then my third thought is connected to an item that was on one of the images that Raglan shared, that had the recommendations and next steps from the systematic review. But part of what, like, of all the things listed there, one of the things that I'm most excited about building into my own practice, for example, would be working with community to just determine like what are indicators, like how do we know that the work was done in a good way. And oftentimes you can know a bit during a project, but so much might still happen. And if you're trying to do something sustainable, that it would be nice to have opportunities and build in ways to actually go back to work that was done previously to know whether or not it did what the community wanted it to do. And I don't think we do very much of that. And if we do, we don't necessarily write or share about it very often. But I'm inclined to think it doesn't really happen that often.
Yeah.
Hey, Mel, I might jump in there just quickly, because I think in different ways it does happen. And I guess that's about our social and kinship lines of accountability, right? So like for me, I know if I do a bad job, I won't be going back to that community. Like that community just won't work with me again. So I think, and I guess that's where it's trying to think a little bit about what are those values and principles, or how do we come to that knowledge? That's not to say that the work might be translated, or we can do a better job with the translation process, or whatever, quotation marks, translation process. But I think there are accountability measures in place that we don't always give value to. And I know it'd be the same for you. I know if you were doing work with Six Nations or something, or whoever, if you didn't do a good job and they weren't happy with you, you wouldn't be going back there to do surveys or focus groups or whatever it is. And it's similar across Australia. I think it's a small, to some degree, it's a small world, and people know each other and people talk. And so I think that accountability is really important. I think sometimes, unfortunately, that accountability gets confused with other things. I think, and I'm not saying lateral violence doesn't happen, but I feel like sometimes that's a bit of a colonial term that might be a bit appropriated in some ways. And I think sometimes actually it's about accountability and making sure that we hold each other to account. And I know the people I partner with, I'm very confident that they'll hold me to account. I know if I mess up in community that Michelle will call me up and tell me off, and she'll ground me or flick or whoever. So I know there are implications for that. But I think we can do a better job in definitely talking about it and raising awareness. And I think you're 100% correct around communities don't necessarily know what sort of opportunities there are for knowledge translation. One of the reasons we had Maya do that artwork was because at the back end of last year, when communities were putting in funding proposals and doing some strategic planning, they're like, oh, you know how we did that like sort of community tailored report and the PowerPoint and the fact sheet? Like what we really need is like an Instagram post or like things like that. So it's just some of those things that are a little bit outside the box to share information and to increase its longevity. I guess that the challenge we also have is we might have a 3-year project and then, you know, we get a report and a PowerPoint in an academic pub and people look at it 3 times and then that's it. So like, how do we, even though the value of it might be, you know, decades, or it might be, you know, a little bit like a ripple in the ocean, it might continue to move on. So how do we increase that longevity of our findings and the research so that people can continue to build on it? Sorry to rift.
No, it's perfect. I do have one question in the chat that might be related, or in the Q&A rather. So any thoughts on the barriers to evaluating Indigenous knowledge translation and potential mitigation strategies? Just because it can be an afterthought for some researchers, and it's also, you know, not always as valued by academic institutions. So barriers or opportunities for evaluating Indigenous KT. Anyone? I'll open it up just to who would like to respond.
I'll speak. Oh, Michelle, go on.
Well, I was like looking at you. I mean, it's really going to vary, isn't it? If you're looking at evaluating KT, to the KT approach that you use, but also the reach of your knowledge translation. I've never formally evaluated my KT, but as we spoke to our relationality, people are holding us to account in very particular ways here in Australia that if I wasn't doing anything, then, or if it wasn't useful, they wouldn't be inviting Raglan and I back to those national workshops. We do have evaluations quite, when we've run workshops, for example, we've had evaluations done on the usefulness of the work and how likely is it that, you know, this is going to benefit your practice. And that's usually quite high. Long-term evaluation, I think, would really, that would be tricky, but it's also up to the individual and it would be unfunded. And so there's sort of those systemic barriers that we do face when we're thinking about or planning for knowledge translation, is that there isn't always funding available to do that work. But if we have these long-term relationships that go beyond just a project and a KT of a project, and then we're moving on to something else, that it's inherent in the work that you do. I mean, people in Australia know that if you want to talk about Indigenous tobacco control, that you talk to Raglan and I, essentially, and we are held to an account. You know, I've gone to do knowledge translation on, you know, smoking and pregnancy with my community, and they sat with one of my community partners. They've sat me down and said, right, it's all about vaping, Michelle, we're pivoting, right, this is what you need to do. And they're holding us to account of, okay, we've done something on that, now your job's to go over here and do that. So it really does come back to relationality, I believe. Raglan, didn't know if you want to jump in.
Yeah, but I think there's an important piece there. I think there is more work that we need to do around evaluation. I think that the systematic review highlights, 51 articles. Like, I don't know how many articles are on Indigenous health and wellbeing, or doing research in Indigenous contexts. And but I think there is more work there, and I think that will help address, Melody, that the issue, one of the challenges that you were talking about around communities not knowing their rights and responsibilities, what rights they have to hold researchers to account, and what options they have. And so I think the more we can write about it, even if it's sort of like reflections from the field or implementation science aspects and other things, but I think there does need to be some evaluation around it, because I guess the other piece is around, like, what are we actually communicating? Like, what is it? Like, say, communities might love the research and the experience. We might have a great workshop. People might want it to go for longer and things like that. But if we also got to find out, like, what is the outcome that we want to look at, and what is the knowledge that's being shared or generated, or what is the, ultimately we're all doing research to change something or to inform something. So if that isn't changing, then sort of what's the point in doing research? So I think some evaluation around that and around the comms aspect would be really useful. The other thing I was thinking, I just share this because I was at a Indigenous conference, a Pacific Indigenous conference last week or the week before. And I thought this was a neat discussion, but the conversation went along the lines of, like, it was around art and climate change, and the amount of research that goes into different art pieces. And this Indigenous woman was sort of talking about whenever she does art, it's actually it's not just art for art's sake, it's communicating a message, it's sharing research findings and other things. And the fact that, anyone would just do art for art's sake, in her mind, was like absolutely ridiculous. Like, it's a waste of time. Like, why would I just make art, in quotation marks? It's me communicating a message. And so I think the more we think about the purpose and the intention, so when we talk about doing research in a good way, I think it's not just about, like, the conception of research, it's about the whole process and the whole journey, about what is that Albert Dumont has the teaching. And I understand I can share that teaching, my interpretation of his teaching with me, which was it doesn't matter if you throw a pebble or a rock or a brick or a fridge into the lake, there's still going to be ripples, and it doesn't matter what they are. They will always be ripples. And so I think it's important to think about that, like, what is the ripple effect from our research? What is it that is going to change and inherently change things? And so I guess one of the things I constantly think about is that teaching about what is the ripple effect of the research that we're supporting and engaging.
Thanks. Felicity or Mel, did you want to comment or? Okay. So a few questions here from looking for advice or directions for non-Indigenous researchers in Indigenous health research. How to be a respectful partner in this space and, not get in the way.
I'll just jump in real quick. Firstly, like the 1,000 cups of tea thing is important, but also, like, as someone from the Bargamani and Mottawa clan, like, I'm generally off country more than I'm on country. So whenever I think we're working with Indigenous people, just recognising that diversity is really important. So it doesn't, just because we're Indigenous doesn't mean that we have the same sort of worldviews or other challenges that other Indigenous people have. In fact, sometimes, like, our experiences of colonisation or other things can be really, really different. And actually, it might be easier to have a non-Indigenous person come in. So I think, coming back to that relationships, 1,000 cups of tea. The other piece I just wanted to touch on, and one of the beauties of being able to spend some time on Turtle Island is I realised some things that we do really well, and then some things that maybe we can poach that from Turtle Island and tailor it for ourselves. But there is infrastructure in place already. Like, we know that there's FNIGC, there's Métis Nation of Ontario, there's a whole range of existing infrastructure that is already in place. And don't get me wrong, I know those guys are very busy and they have agendas, but we can learn from that. We can look at strategic plans and priorities. We can look at the Truth and Reconciliation report. We can look at all those things to get insight as to what it is that are priorities for Indigenous peoples and find out, like, how can we help? So I think having that 1,000 cups of tea, trying to figure out where we fit in that piece of the puzzle. Because the other thing is, and as Auntie Maria Campbell has said, we all have a different piece of the puzzle, and the puzzle is massive. There's so much work to do. So it's how can we do that in a good way? Thanks.
Michelle or Felicity?
Yeah, I'm happy to jump in. We get asked this a lot, and I think back to my own work is that when I was growing up, I was taught to be very humble. And so I believe that if Indigenous researchers approach Indigenous communities with humility, that will be a good first step. I get asked all the time, how do I engage Indigenous peoples here in Australia, given the infrastructure is different? We don't have treaty. And they'll say, I've tried to call and they just haven't answered. Sometimes that is your answer. And just because you have the best of intentions and this great idea and all of the resources to do it does not mean that that's the priority for Indigenous peoples. And so being really humble and respectful that what is important to you might not be what is important to the Indigenous community is really important. But also to raise that a lot of us, as Raglan said, I am from a very particular area of a very small part of this really large country. So even as an Indigenous researcher, it doesn't mean that all the work I do or all the communities I work with, I have relationships with, kinship relationships with. So I still go into a lot of places and I'm a light-skinned Aboriginal woman. So I need to always build respectful relationships and know that over time that's really important to sustain. It's not just that, if you say that you're Indigenous, immediately you get different treatment. We're held to a very high regard, and we also have very long lines of accountability if we stuff up. So it's not particularly easier for us. Everyone has to do the same thing of being humble and being respectful, but also acknowledging that, you might not be the most top priority for the community. Flick, did you want to add anything to that?
Yeah, I was thinking when you and Raglan were both talking and you touched on it just now, and in your slides, but around sustaining those relationships. I think it's really important for our non-Indigenous researchers to remember that sustaining relationships is in terms of their own relationships that they start to build with communities, and understanding the care and the responsibility that comes along with those relationships, and that's always ongoing. And to, I guess, keep that in mind when you're building those relationships and you're coming into communities. But the other thing to be mindful of, I think, as a non-Indigenous researchers, is the sustainability of those relationships. You have a responsibility to your Indigenous researchers that are coming along with that, because at the end of the day, if you, as a non-Indigenous researcher, stuff up, or you cause offence to someone, or whatever it might be, the responsibility and the accountability for that is going to come back to us as the Indigenous researchers within those communities. So it's really important to hold regard for your own relationships, but those relationships that your Indigenous researchers and leaders also have with those communities. So for me, it would just be really carefully considering that, and just being really respectful of that on multiple different levels.
Okay. I just have another question here about your advice, I guess, for how you go about doing KT when research is about Indigenous peoples in a much larger context rather than a specific community. So what kinds of strategies could you use to make sure that you're being respectful and engaged, and that action, can happen at that larger scale that you're trying to speak to? Who wants to try to tackle?
I feel like it's always me kicking off. Got a little order going on. For me, I think it's just building on the infrastructure that exists. So for us, if I'm doing work at the national level, and I also cautious not to pan-Indigenize people, there is great diversity in Australia, 250 languages and 800 dialects or something like that, time of colonisation. And PNG is 800 languages. So we're talking a diverse bunch of people, different protocols, etc. So I guess that's the first point, is acknowledging that diversity. And then also, it's also important to acknowledge, and maybe if you read that ethical article in Tobacco Control, publishing in ethical contexts, Indigenous contexts, it's important to recognise that relationality, and things like age, sex, gender, all those things actually impact the way that we come to know things. So whatever the messages we're communicating, whatever people are hearing might be different as well. So that's a diversity piece, how we would go about it. My first step would always be, well, obviously I'd develop the research with communities, but depending on what level the community is, so if it's local, regional, state, or provincial, national, I would try to operate at a governance level for that. So if it's a national piece, I'll go to national governance. So I generally work with someone like the National Aboriginal Community Controlled Health Organisation, or Lowacha Institute, which Michelle happens to be the KT manager for, so that's useful, or something similar. So if there's infrastructure at the level that you're trying to share a message or trying to share research or develop research, I'll try to operate at that level. And then vice versa, if we're going, even if it's at a small level, if it's, the Kenora, which isn't that small, but Kenora will be an example, then you might go to the local health organisation in Kenora to make sure that whatever you're doing is reflecting the respective protocol. That would be my 2 cents.
Thank you.
Yeah, absolutely. But I also think that if you're doing anything to do with Indigenous peoples, it doesn't hurt to continue to talk and critically reflect with Indigenous peoples. If you're looking at, in Australia, doing something nationally, while Raglan and I do work with our peak bodies and our national bodies, and I work for one of our national bodies, it doesn't ever stop me from ensuring that my local community agrees with what I need to do, or for me to critically reflect on something I'm trying to change nationally, but ask my local community or the peoples in which I have relationships with, how do you think I need to get this message across? Have I got the message right to begin with is usually the first thing. Please call me out if I'm actually getting this wrong. But also what would you need for us to make this actionable? What else do we need to be building into this work so that it is of use? And as much as possible, I like to speak to everyone, all the diverse communities, because it might mean that one KT approach is going to work for one community, but also acknowledge that there is so many communities in our country particularly. So I need to make sure that I'm continually reflecting on, and KT being an ongoing process, not just, you know, a slide deck and a workshop and tick off we go, is to really critically reflect and speak to as many people as possible to ensure that the KT is correct. Because what KT is needed for policymakers is going to be different to if I'm trying to change practice in a service. Or if I just want Aboriginal people to know a message or something that we've found that's of use. And that colonial machine Raglan shared is one of the ways in which he's been, you know, leading some work around how do we have some of this imagery that we can share with our communities to ensure those messages are coming across. That was just my 2 cents.
So we've got about 10 minutes left. So I think what I'll do is just maybe ask one last question, and then we'll let you guys start your actual day now that the sun is up for you guys. So in Canada, we have a term coined by Mi'kmaq Elder Albert Marshall called two-eye seeing. And it's kind of blending Indigenous and Western knowledge in your work. And I know that it's always, it can be a challenge because there's a lot of the Western knowledge or research that's out there is very deficit-based and pan-Indigenous and those kinds of things. So I'm just wondering advice for people doing KT that want to have a good blend of knowledges and make sure that they are doing things in a good way. I'm thinking Maddox in particular, Raglan, your ethical citations that you mentioned maybe even would be a good start.
Yeah, thanks, Donna. Yeah, I think the two-eyed seeing piece is really important. I think yeah, gosh, we use that word sort of meaningful or doing work in a good way a lot, hey? And it's sort of vague. I think people use it. Yeah, sometimes it can be a bit of window dressing, but I think the first step is to acknowledge what we don't know. And I think that's half the battle. I think, you know, for me, I'm not an Aboriginal or Torres Strait Islander person, so I acknowledge or have to come from the starting place that I know I'll never understand what it's like to be an Aboriginal or Torres Strait Islander person living in Australia. And I think from there, I can then start to unpack what values, what other things that I bring to the table and what that does for the work that I do. I grew up with a single Black mother. And so that shapes the way that I see the world. To me, my mum was my rock, my cornerstone for the first 40 years of my life. But it changes the way. Whereas if I read the newspaper, The Australian, I would think that every Black woman in Australia is, you know, a problem to the system and a burden to society. So it inherently changes that. And so I think the first step is to question everything we know and why we know it and how we come to know it, which is sort of why I tagged in those ethical pieces. Because if we start to unpack that piece, and I guess when I think about two-eyed seeing, I sort of think of the colonial lens almost like a bee or a fly or something, and we sort of have to peel back all these pieces that influence the way we see and shape the world. And the more we can understand why we sort of have this prejudice or bias, we can then act on either not acting on it or be aware that, you know, these are the processes that mean we privilege old white men, for instance, or that, you know, when we look at the academic literature, they're the people that have been so prominent in academic literature. And so, you know, the foundation that we're building work on has to understand that that's where we're coming from. So I think in terms of two-eyed seeing and that sort of approach, I think, or if we start to look at, you know, decolonizing methodologies and other pieces that sort of are being more commonly used, or maybe not commonly, but are becoming increasingly used, I think that's really important. So probably a couple of pieces that I'll share that myself, and I'll steal a couple from Janet Smiley as well, is I know Janet, when we used to sit on the subway, she would look at someone on the subway and would just challenge why she thinks about certain things. So she might see someone who might not be wearing shoes on the subway and be like, maybe that person's just finished 9 holes of golf and had wet feet and just collected $3 billion on the pro tour. But just questioning why she has certain stereotypes about someone so that when she's engaging in research, she questions them. The other piece that I like to do, or when I'm doing sort of cultural safety training, sometimes I get us to do is just to think about births, deaths and marriages. And so I like to think about why we do certain practices at those occasions, births. So an easy example is, like, why do we pass on our last name, or why do we have a namesake? So for me, like, there's a bunch of kids named after my sister. It's like, why do we do that? Like, why do we honour people in that way? And then same with deaths and marriages. So why is it that we always pass on the male last name? Or why is it that so for me, I come from a matriarchal society, but for whatever reason, like, we still take on the male last name. And then same with every practice. So those sort of things, or celebrations, whenever we sort of think about that, it's like, oh yeah, why do we do that? Why are we celebrating? What are those values and principles that we might then be projecting onto others, including through our research and then our KT practices? So question them, because that'll give us a better understanding of ourselves. And then once we understand ourselves, hopefully when we're engaging with people and doing research, we can do it in a meaningful, quotation marks, or do that in a good way. So I'm not even sure if I answered your question, Donna, but there's a couple of tips, I think.
Sure.
Thanks.
Sure. Felicity or Michelle?
Yeah, I'll just build on Raglan, because I do think it is really about questioning. For context, for those who don't know, Aboriginal and Torres Strait Islander people have only been allowed to be educated within the university for not even 60 years. So for us, when we've come into university, it's I feel like it was at the forefront of my mind, thinking that this isn't an opportunity that my grandfather was allowed to do. So we know that going into this system and the system of research, that our ways of knowing, being and doing aren't going to be privileged here. So ensuring that when we're addressing a research question, or we're moving through developing a knowledge system, that we reflect on Indigenous knowledge as first and foremost. What is it that our people would ask of this? What ways in which should we be generating that knowledge? Because we know that you can do a research project on the same topic in a different way and get a different answer, particularly when you're engaging Indigenous peoples. And I know that when I did my first research, the fact that I was an Aboriginal woman and a mother, asking Aboriginal women in my own community what their experiences were of smoking and becoming pregnant, through relationality, I got different data than anyone else would have been able to get, particularly non-Indigenous people. So acknowledging, for me, I mean, we don't have the two-eyed seeing. I try and go from Indigenous knowledge as first. And also whenever I read something, when I carefully pick through the literature, even when Raglan and I were doing our MJA supplement, and they would say, this is how we do it here. We analyze this against educational outcomes, ensuring that I'm grounded in what our Indigenous communities are asking first, and saying, well, the way you're doing is not right, and we're going to do it this way, because this is what Indigenous-led research is asking of this research. So for me, I think a lot of that within an academy that wasn't built for us and excluded us for such a long time, I have a really big responsibility not to have two-eyed seeing, but have pushback on the colonial machine that has been knowledge production within the academy. But Flick, please add on anything.
I'm glad you started with that much more eloquently than I probably would have. I think for me, I come into this space always as a sovereign Aboriginal woman. So I find it really hard to conceptualize two-eyed seeing. I know, the political space that we're even in Australia at the moment, where we're trying to get constitutional recognition, really impacts on the way that I'm able to, I guess, engage in the concepts around two-eyed seeing. And as you said, we often refer to two-way learning in Australia. And so for me, it's just continually coming back to my roots and my responsibilities to being Aboriginal in my community first and foremost, and being able to continually have that pushback and uphold that within the academy. And I guess coming in as a junior or a baby researcher in this space, I know that it's always also been really important for me to be supported in upholding that. And that's my son on the side. Sorry, but thank you.
Sorry, just to add to that, I guess it doesn't mean we wouldn't do a logistical regression. like we're not completely saying we're not doing any Western research methodologies, but it's, as Raglan presented in his slides, really critically reflecting on the work that we're doing and is this the right way to do it?
Great. Thanks so much, everyone. So please join me in thanking our speakers today for sharing their knowledges and their experiences. It's been really insightful to learn from you from a very different side of the world. And thanks also to Mel for bringing this group together and helping to organize this. Sorry that we didn't get to everyone's questions. There were a lot of them. And yeah, this webinar will be posted on our website after the fact, and we'll make sure that we link to all the good resources that these folks were talking about while they were presenting. So thank you, everyone. Have a great day.